Okay, well, thank you very much. It's a pleasure to be here today. I'm going to speak with you just on background about heat and how your body adapts to it, and health outcomes, what are they, and how do we think about them when we're measuring them. So first off, there are 4 ways in general that we dissipate heat from our body. Our body develops heat from its core internal organs, and we need to dissipate it off of our bodies in order to not overheat. So the 4 ways are evaporation, convection, conduction, and radiation. And those are the 4 main ways. So of those, perspiration is the biggest contributor to losing heat from your body. Heat is pulled out of your nearby blood and skin as your blood is pumped towards your skin, your vessels dilate, and you perspire, the body cools down. Now, evaporation, though, requires a gradient in humidity. So evaporation in the form of perspiration becomes ineffective at high humidity. The next 2 are conduction and convection, which contribute much less than evaporation. Conduction is when you lose heat through physical contact with another object or body. So in this photograph of me, the wet clothing on my back is conducting heat off of me. So in an extreme heat event, placing a towel or a bandana against your skin that's wet to help absorb some of this perspiration is something we all naturally do, and this continues the cooling process. Convection is a process of losing heat through the movement of air or water molecules across the skin. In this case, it's the air rushing off my nose, as it looks like in this arrow. So both conduction and convection, though, again, require a gradient, and both become ineffective when the temperature around a body exceeds its core temperature. Our normal core temperature is about 98.2. So as soon as the ambient temperature increases above that, that gradient becomes hard to perform. Lastly, radiative cooling is a small contributor. It's the process by which a body loses heat by thermal radiation. It too becomes ineffective when the ambient temperature exceeds the core temperature. So as I said, evaporation, perspiration is the main way we lose heat from the body. The circulation occurs so that as our body is starting to heat up, we are shunting blood from our organs, from our lung and heart and kidneys, out to the periphery and out to the peripheral blood vessels that then dilate and enhance cooling through the skin. When the ability to cool the body is inadequate, the core temperature rises. This results in the clinical symptoms and syndromes that we're going to be talking about. And it does that through a lot of biological pathways, inflammatory responses, cellular breakdown occurs. And it manifests in a few different ways. The first is that if you have a chronic disease, it will exacerbate your chronic disease. If you have decreased kidney function, if you have heart conditions, if you have lung conditions, all those can be exacerbated by the increasing temperature and metabolic derangements that are occurring and inflammatory derangements that are occurring in your body. It also causes heat-related illnesses. And heat illness is a grab bag of 10 conditions. And the most severe are heat stroke. But there are milder forms such as cramps, heat cramps, or heat edema. And in practice, doctors can often find it very difficult to make the diagnosis of a heat-related illness, since the symptoms of a heat-related illness can look a lot like exacerbations of chronic diseases. So for example, an elderly woman is brought to the clinic feeling nauseous, with lethargy, and a temperature of 104.2. She may have incipient heat stroke, but she also may have sepsis from infection. She may also be having a stroke or meningitis, and it can be very difficult to tell sometimes. So there are some factors that we know create greater vulnerability to the effects of heat. We know after many studies now that the extremes of age, the oldest and the youngest, are some of the most vulnerable. Certainly 65 and older has been sort of a demographic cutoff we've seen in studies, but the older you get, the more vulnerable that is. And also young children, especially infants, are vulnerable. Health conditions, baseline health conditions that you have. So heart disease, diabetes, but also certain medications that people take, such as beta blockers, can predispose to harmful effects from extreme heat. Obesity, alcoholism are also documented. The conditions in your home and neighborhood are very important to the vulnerability of groups and to people. So as would be pretty obvious, if you are living in a neighborhood that's very hot and you have no air conditioning, that's going to be a major contributor to your vulnerability. And neighborhoods that are impoverished tend to have lower rates of air conditioning, so we often see the effects of extreme heat even higher in impoverished neighborhoods for multiple reasons, including the redlining effects that Edith talked about, as well as these sort of resource allocation issues of lack of air conditioning. So those neighborhoods are hotter, as Edith talked about. They also have greater hardscape, so they are absorbing the heat and reflecting back at night, so that the temperature at night never fully cools off, which is very important to the developing extreme heat health conditions. We need to cool off at night. Social isolation has been discussed as one of the most important forms of vulnerability. And lastly, social conditions. The social determinants of health, such as poverty, structural racism, being an outdoor worker, all matter. So let's just go through this conceptual diagram. It illustrates the key pathways by which extreme heat and climate change is going to lead to worsened health. The center boxes show the pathway of increasing frequency, severity, duration of extreme heat, increasing the temperature maximums, minimums, and means, leading to more deaths and hospitalizations. The gray boxes show that this pathway exists within the context of other factors that positively or negatively influence health outcomes. Key factors that influence vulnerability for individuals are shown in the right box and include the social determinants of health and behavioral protections. Key factors that influence the vulnerability at larger scales, such as natural and built environments, policy and management, that we are talking about today, are shown in the left box. All these influencing factors can affect individual and community vulnerability by their effect on changes in exposure and will also be affected by climate change. So we do talk about two sets of outcomes in health outcomes, mortality meaning death, and morbidity meaning any episode of illness or degradation of health, which is usually metricized by hospitalizations, emergency room visits, or 9/11 calls. Just to say a word or two about the reliability of this data, mortality is gotten off of death certificates, and physicians complete these death certificates, physicians like myself. But we often lack proper training and experience in filling out these death certificates. In fact, many medical schools do not offer formal training on death certification. Doctors learn on the job, and how well they learn is really unknown. So morbidity is also a very reliable outcome, maybe more reliable in some ways than mortality, because we do get good diagnoses on exacerbations of chronic illnesses. And just to show you, here's a cause of death certificate. We fill this in by hand. And I'll just say that even in the COVID-19 era, we are still having arguments among doctors or discussions among doctors about how best to code these deaths. So this is really absolutely a data reliability issue. Thank you very much.